Hi, my name is Michelle Cordero, and I'm a clinical sales specialist with GE Ultrasound, General Imaging Division. Today I'm going to talk to you about our cardiac ultrasound on the new LOGIQ E10. Lengthy exams can be a challenge in workflow efficiency in cardiac ultrasound imaging. Central to the new LOGIQ E10 is the C-Sound architecture that combines versatile XD Clear probes and the new C-Sound image former to deliver exceptional image quality within fast scan times across a wide range of cardiac exams, even in challenging cases. The LOGIQ E10 with C-Sound image former cardiac application now features ACE technology in adult cardiac models. ACE technology is adaptive contrast enhancement, an algorithm that determines if the pixels are real or artifact. If the ACE algorithm determines the structure is real, for example, the intraatrial septum, then it enhances those pixels. But if it determines that it's noise or artifact, then the algorithm reduces the intensity, therefore giving the user higher contrast resolution for a more confident diagnosis. The LOGIQ E10 features comprehensive tools such as cardiac strain and automated ejection fraction. Automated ejection fraction is a semi-automatic measurement tool used for global ejection fraction. I will now demonstrate how simple it is to use. To perform an auto EF, also known as automated ejection fraction, you simply select your measurement key on top of the trackball, go to your touch panel and select auto EF. We have a 4-chamber view on the screen right now, so you simply go to the left side of the monitor and select 4-chamber tab. Using the right trackball key, select Enter. Now the system is doing the calculation for you. As you can see, it's very simple to use, and it has produced an ejection fraction for the 4-chamber view. If you are happy with that, bring the cursor down to Approve and select the right trackball key to approve that measurement. Another comprehensive tool on the LOGIQ E10 for cardiac imaging is cardiac strain, automated 2D speckle tracking to measure the deformation or strain of the myocardium in real time to assist clinicians in early identification of underlying cardiac disease and aiding, diagnosing, and managing patients with cardiomyopathy. You'll achieve fast, accurate results with a quality indicator notifying the operator of acceptable data quality to support diagnostic confidence in the tracking results, and it's very simple to use. Just a few button pushes and the assessment is complete on the ultrasound system. There is no processing workstation required. Before I perform a cardiac strain measurement, I want to point out the spatial resolution on the LOGIQ E10 with C-Sound image former. Notice the blood flow circulating through the left ventricle, the excellent detail on the valves, and the endocardial walls. Now I'm going to perform the first measurement, which is in 3-chamber view for cardiac strain, also known as 2D speckle tracking. First, I'm going to select the measurement button on top of the trackball. Next, I'm going to select the folder that says AFI. If you notice, down here it says Perform Analysis in the following order: 3-chamber, 4-chamber, and 2-chamber. I'm now going to select the first required view, which is apical parasternal long axis, shown here on the display. I'm going to use the right trackball key, and the system is doing the speckle tracking calculation. Once the speckle tracking is complete on the 3-chamber view, you will notice that you have a green check mark under each segment, letting you know that the system likes the speckle tracking. Using the right trackball key, simply select Approve if you are satisfied with that measurement. If not, you can simply select Recalc from the touch panel, and you can move a particular segment by right-clicking and changing the wall, and it will recalculate for you. Now select Approve using the right trackball key. We have various display formats for your speckle tracking, from a bullseye map to the 3 chambers with the bullseye map and your correlating numbers on the right side, and your longitudinal strain map. And as you can see, the colors on the right of the longitudinal strain correlates with each different wall segment. Again, lengthy exam times can be a challenge in workflow efficiency in cardiac ultrasound imaging. The LOGIQ E10 can help shorten exam times to help you achieve concise workflow efficiency in cardiac ultrasound. One of our most powerful workflow features is raw data. The LOGIQ E10 now captures twice the data and helps shorten study times by enabling image processing and quantification after the exam has been completed. I'm going to quickly show you on the display how easy it is to adjust some of the imaging parameters on the system. Starting at the bottom right corner of the display, I'm going to lower the TGC. By choosing the right split screen button, I'm going to move to the top image, and I'm going to select near TGC and just brighten up the apex, just a couple of clicks. Next, I'm going to move to the upper left image, and I'd like to pop the apex a little bit more. I'm going to add a colorized tint map, and now we can see that endocardial border much nicer. I'm going to come down to the left lower side of the screen to the short axis view, and I'm simply going to reduce my gain to clean out the left ventricle. And that's the power of raw data on the LOGIQ E10 with quad screen clips and raw data. Thank you for your attention during this short cardiac presentation on the LOGIQ E10.